Hey, So Focus family, welcome to Get Off My Nerves. It's another week. Hopefully, everyone's doing well. I'm Dr. Lanzano. For those of you who don't know and haven't or just joining us on these sessions, it's Dr. Grayson.
How we doing, guys? Good to see you again.
We are both chiropractors. So today, during this segment of Get Off My Nerves, we're going to be talking about carpal tunnel. So real quick, what is carpal tunnel? So carpal tunnel is an anatomical landmark in your wrist. So in that anatomical landmark, you have a nerve called your medium nerve, which runs underneath the wrist here. And then you have a sheath or a retinaculum, it's called, that goes over right here. So what are some symptoms of carpal tunnel? So a lot of people think just because you're going to get pain in the wrist, right in this segment right here, that's carpal tunnel. That's not true. Carpal tunnel syndrome, the true symptom of carpal tunnel syndrome is you're getting numbness and tingling in these three fingers, the three lateral portion of your hand. Now, what causes that? It could be a bunch of factors, which we're going to get into later, but that's just one of the main symptoms. Numbness and tingling are shooting pain into these three fingers. Now, it's important to differentiate if it's coming from your wrist, your elbow, your shoulder, or your neck, and we're going to go into like maybe some orthopedic tests and how we can show them where they can figure that out. Also, in more severe cases of carpal tunnel syndrome is you'll get atrophy of this muscle. So if you compare them, and you are getting the numbness and tingling into your hand and it's going on for long periods of time, if you compare your hand size, the padding here, your thenar muscle, and it looks weaker or thinner, it could be a more severe case of carpal tunnel. So you definitely want to get that checked out. Also, now there's many things that can cause carpal tunnel syndrome. Now, it depends on what you're doing. Generally, it's from a overuse of the wrist. So depending on what you do as a job, or if you are a hobby, if you like to use an instrument and you're playing an instrument long periods of time, that can cause it. If you're a mechanic, if plumbing, anything that you use your hands can cause carpal tunnel syndrome. And a lot of people now, since they're out of work or they're working from home, one of the main things is, sitting on a computer and sitting in this position with the flex of the wrist can cause a lot of pressure on that median nerve, which will cause carpal tunnel syndrome. Also, if you look at the research, not necessarily correlated, but research shows pregnancy, people who are pregnant are more predisposed to carpal tunnel, as well as menopause. So there's definitely a bunch of factors that could be causing your carpal tunnel syndrome. So what we're going to do, Dr. Grayson's going to go into the anatomy a little bit, and then we're going to go into what we can do to help.
All right, guys. I'm just going to break it down. I'm going to show you a model, and then I'll just demonstrate and go into it a little deeper. I'm going to get as close as I can here. As you can see in the wrist, there's actually 8 carpal bones is what they're called. The bones in your wrist. This would be your forearm. This is your hand, obviously, and these are the bones in between. And there's actually 8 different bones in there, and each one can be individually out of place or what we call subluxation. And when those bones are out of place, that's when we start to see dysfunction or irritation, and that numbness and tingling could just be pain. So essentially, what we're looking at is the carpal tunnel. Is the base of it is going to be the carpal bones. The nerve runs through, along with arteries and veins, that tunnel, and then the retinaculum, like you spoke of, your skin, and there's a ligament that runs over top that holds everything down in place. So everything runs through there smoothly, and when there's no issues, when there's no entrapment, when there's no irritation, the nerves, the blood supply gets through well. When we see misalignment of these bones, or like he said, anything overuse, irritation to the area, the nerve, overuse of the muscle, anything like that can cause irritation, can cause dysfunction with that nerve. Again, it's the median nerve coming through. It could also be the ulnar, but that's a whole different story. So what we're going to continue with is just the carpal tunnel and that median nerve. And what will we do for treatment if you're having those symptoms? If you're at home, you're on the computer, your wrists are flexed, or if you're using your hands a lot, like he said, musicians, cooks, cleaning, anything like that. Essentially, what we are looking for is either an increase, as clinicians, what we're looking for carpal tunnel is an increase of the size of the canal, the increase of the contents going through the canal, the nerve, artery, the vein, or a decrease of the size of the canal. And when those bones are misaligned, the size of the canal shrinks. So what we want to do is make sure the canal is in its proper size so that everything can function smoothly. So with the treatment, what we can do as chiropractors is we can adjust. We can go through, we can evaluate the wrist, as well as the elbow and the shoulder. Like he said, if it's true carpal tunnel, the issue is going to be in the wrist. but you can get pain in the wrist or into the hand, and it could be coming from the elbow, the shoulder, or the neck. So our job is to decide where the entrapment is, and at that point we can give you the best treatment that you need. If it is in the wrist, we can individually adjust each one of these 8 bones. We can also come up and adjust both bones of the elbow. That's what we would do if you were to come in with the symptoms. We would evaluate, we'd find out where the entrapment is, and we can treat with the adjustment. As far as at home, right now, obviously we can adjust you virtually. So what you can do is you can ice or stretch the area. When you do stretch, though, you want to make sure that you're not. A lot of times you'll see people saying if you have carpal tunnel, you want to fully stretch this way or fully stretch that way. And that actually, both directions, close down the carpal tunnel. That actually increases the pressure on the nerve. So the best thing for it is distraction, meaning pulling this way, keeping the elbow and the wrist straight versus increasing or decreasing the size of the canal. And then we can also, you can brace it. If you're sleeping, if you get a lot of numbness while you're sleeping, or if you're waking up with that numbness or tingling, you can brace the wrist. But a lot of the braces you'll see hold you in this position. And again, that is increasing the sensation, decreasing the size of the canal, and increasing the pressure on the nerve. So if you're wearing a brace, you want to make sure you're staying neutral in the wrist as you wear the brace. Another thing you can do is just avoid anything over pressure. If you know it's a certain, what's the word I'm looking for? A certain factor that's bringing in the pain. Say you get the pain while you're driving. Do anything you can to avoid those positions. Obviously, if it comes down to work, you can't always avoid what you're doing for your job. But if you can narrow it down to a certain factor or two that are causing or increasing the symptoms and the pain, the best thing to do is to either slow down or avoid those activities altogether. So the first thing you need to do is get evaluated to find out where the entrapment is, and then at that point we can give you the best treatment moving forward.
Right. So like there are, like Doc said, and you want to differentiate where it's coming from. And that's where we come into play. So if you have numbness and tingling in these 3 fingers, it could be coming from your wrist, which is your median nerve. It can be coming from your elbow, which is your ulnar nerve, which runs through this groove here. If there's any misalignments of the elbow joint or the radius to ulna, that can cause numbness and tingling. If you have a brachial plexus, which is here, if you have any misalignment of the scapula, which I know we briefly talked about last time with our other video, if any misalignments there or any misalignment to the shoulder, that can also cause numbness and tingling. Or if you have any problems with your neck, whether it's degenerative joint disease, which is just arthritis, any misalignment to the vertebra, that can all of which cause numbness and tingling. So what we like to do is some things you could do at home as well to see or differentiate if you're getting numbness and tingling is some orthopedic tests. Now, you don't necessarily have to be a doctor to do so. You just have to know how to do it correctly. So I'm just going to demonstrate a few. Actually, we could just do failings. So what you want to do is here. It's like a prayer pose, I guess you could say, and come to here. And what you want to do is hold this position for, I think it's about 30 seconds to a minute. When you do this for about 30 seconds to a minute, if you get reproduction of that numbness and tingling into the hand, that's a good indication that you could have carpal tunnel. Another one would be reverse failings. So you'll go like this, bring your elbows down, and just like this, hold it again for about 30 seconds to a minute. If you get that reproduction of pain, the numbness and tingling into the hand, that's a good indication as well. And another, if you have a partner, significant other, kids, you can do this on each other, where you find, come closer. So in between these 2 muscles, right in here is where the median nerve generally is. So what you want to do is make your hand like this, and you just tap that area. That's called Tjelle's tap. If you get a reproduction or shooting pain in that hand, that's another thing you can do. So they're not necessarily 100% meaning it's carpal tunnel, but if generally those 3 are positive, it's definitely a good indication. And again, you want to be able to, seek attention, to come to us where we can help you, or whoever you can indicate what's going on. So do you have anything else, Doc? Do you want to show them the adjustment?
Yeah, we can show you the elbow and the wrist adjustment. We're not going to go through and explain how to do it, but we can demonstrate it quick just to show you what it would look like if you were having those symptoms and you came in to get the treatment. And we'll go from there. All right, so say he was having symptoms into his right hand here. We can start at the elbow. We would have already evaluated the neck and the shoulder. If we get into the elbow, we can. There's 2 adjustments we can do here. Just let that relax for me. adjust the elbow here.
Oh, nice.
Straight across. We can check the other bone. Straight through there. And after we clear the elbow, we can come down and check the wrist. Again, there's 8 bones in the wrist that each one can be individually subluxated or misaligned. And the main 2 that we're looking at, the main 3 with carpal tunnel, let me just show them quick on this model. This would be the back of your hand. So if I flip through, it's going to be the 2 dead center and then the 1 next to your thumb. So these 3 bones have the most articulation with that carpal tunnel, and they have the most influence on the median nerve, which runs right over top of them. So you can see if this bone was turned this direction or that direction, how it would increase pressure on the nerve.
And I don't know if you guys heard that in my elbow, but it felt amazing.
So again, then we would look at the wrist. Just let that relax.
Nice.
Good. Check that thumb. Nothing there. So he only had two or three bones that needed to be moved, and he wasn't having symptoms there. But that would be a quick demonstration of a treatment. We would check the elbow, we'd check the wrist. This would all be after an evaluation and a demonstration, obviously. But it shows you how easy it could be, and
it doesn't hurt. It feels great. Like sometimes you'll feel like a cool sensation to your fingertips, or maybe a warm sensation. Sometimes you'll feel like if you have numbness and tingling, some of our patients where they'll have it constantly, and we've adjusted people like that. In some instances, it's completely gone. So it's not always the case, but after repetitive adjusting, we can sometimes avoid a carpal tunnel surgery. Not saying that it's going to heal everything, but that's our mission to help people avoid, not saying it's unnecessary, but surgeries or medication. So always try your holistic approach first. Also, too, with the surgery, I just want to mention real quick. So the surgery, if you look at the research, what happens is when you get a surgery, your body's going to build up scar tissue around that area. So sometimes, well, it's true, scar tissue is thicker than that retinaculum and ligament that runs across your wrist. So if you, again, we want to increase the space here. We don't want to compress it because that's just going to make it worse. So sometimes with surgery, if you build up too much scar tissue, what's going to happen is you'll have more compression on that nerve, and sometimes it'll eventually come back, where we have had instances where, patients who have gotten surgery and it has come back. But again, you always want to try your holistic approach first. At least that's our belief. And again, if that helps, that's ultimately what we're trying to do.
Yeah, so that's about it for the content. If you're at home, if you're working from home on your computer more than you used to be, if you're having pain into the wrist, into the elbows, numbness and tingling, anything like that, just a good indication that you might want to get that evaluated. It doesn't necessarily mean you have carpal tunnel syndrome, but if you're having symptoms like that, it's best to get it evaluated and find out where it's coming from so that we can give you the best treatment.
Right. All right, I'm Dr. Lanzano. Thank you guys for tuning in to Getting Off My Nerves. Again, if you guys need anything, we're in the office, Monday, Wednesday, Fridays, 10 to 1, 3 to 7. We'll be happy to do house calls, send kits, whatever you guys may need. We're here for you guys, and don't be afraid to reach out.
All right. Have a good one. See you next week.